Good afternoon, everyone, and Happy New Year. This is the first such press briefing we've had in some time in relation to influenza. But since our last briefing, we've continued to make information in relation to influenza available, particularly since the beginning of the influenza season in October. We've provided in the usual way the weekly update through the HPSC website. You recall that we used the influenza-like illness rate per 100,000 of the population as our way of tracking the extent of the disease in the population. And the threshold for declaring the commencement of the influenza season is when a rate of 17 per 100,000 is reached. That threshold was reached in week 50 of 2010, which was the week that ended Sunday the 19th of December, when the rate of 22.4 per 100,000 of the population was reported. The following week the rate increased to 59.5 per 100,000, and this week it has increased to 120 per 100,000 of population. That's week 52 of 2010, which actually ended on Sunday, the 2nd of January 2011. And just by way of comparison, the peak rates that we would have seen during the pandemic was slightly over 200 per 100,000 of population. And if we go back to the previous winter, the winter of 2008 and 2009, when we saw a significant increase in influenza activity, a level of 120 per 100,000 was achieved at that point, but obviously it was not influenza A/H1N1 or swine flu at that time. And it's important to understand that what we're dealing with here is a seasonal influenza epidemic. It's not a pandemic, and it's not a crisis response to a pandemic. It's part of the routine response to influenza epidemics that occur in many winters and have occurred in many winters in the past and will continue to do so in the future. And to that extent, it is something that we both expected and anticipated and would have spoken to you about the possibility of in our briefings in the past. And during the pandemic, we estimated that approximately 1/3 of the population became immune either through infection, through immunisation, or a certain percentage of the population had residual immunity from past epidemics and pandemics in the 60s. We would have liked to have seen higher levels of vaccination. In fact, we have procured sufficient vaccine stocks to have achieved much higher levels of vaccination than we did achieve. But we did witness, as many other countries did, witness a considerable fall in the attendance for vaccination once the peak of the pandemic had passed. We did, however, achieve, by way of international comparison, quite high vaccination uptakes, particularly among children. And since the beginning of this influenza season, we've now had 114 hospitalisations, 33 of which have been admitted to intensive care. And of those 33, 26 as we speak remain in intensive care. And thus far we've had no confirmed deaths from seasonal influenza. And given our past experience and knowledge of influenza, and in particular the pandemic influenza A/H1N1, we would anticipate that we may see an increase in the number of cases reported through the ILI rate each week, perhaps for the next up to 2 to 4 weeks. And at that point beginning to see them fall off. It may happen that it occurs even sooner than that. And it's important, as I said earlier on, to state that this is something that we've both anticipated and planned for, and within our surge capacity in terms of hospitals, in terms of immunisation arrangements and so on, it's something that we're well prepared to deal with. What I'd like to do now is to hand over to Dr. Flanagan, who can speak a little bit more about the detail of some of the rates that I've reported to you.
Thanks very much. Just to say that the predominant virus this year is the H1N1 virus, which accounts for about 89% of our infections. But we're also seeing some influenza B, which is accounting for about 11%. So it's not exactly like we had in the pandemic last year, when it was practically 100% H1N1. We are seeing some other virus strains circulating as well. In relation to the most affected age groups, this last week we have had the highest rate in the age groups 15 to 64, with a rate of 127 per 100,000. And this is followed by the 0 to 4-year-olds with a rate of 130 per 100,000, and the 5 to 14s with 95 per 100,000. Just to emphasise, though, that during the pandemic it was slightly different. It was predominantly in the very young children, the 0 to 4s and the 5 to 14s. For example, at the peak of the pandemic last year, our 0 to 4-year-olds went up to practically 400 per 100,000. So it's a little bit of a different pattern now. It's mainly affecting the 15 to 64-year-old population instead of the predominantly being the very young children and teenagers.
Thank you, Rina. And I'm going to hand over to Dr. Kelleher, who's going to talk about a number of things that individual members of the public can do to protect themselves.
Okay, it's not no different a message from what you said last year, so I'm just going to bring those messages back. It's about looking after ourselves and looking after our friends and family to try and protect them as well. So the first bit is how you deal with, if you've got a cough or a cold, is that you use what we talked about last year: catch it, bin it and kill it. So if you are about to sneeze or cough, it's preferable that you can have a tissue available to catch it, put it over your nose and mouth, and then dispose of that tissue in a bin. As we said last time round, if you don't actually have a tissue, you can put it into the crook of your arm. That is as effective, but slightly less hygienic. And then finally, kill it. And the issue about kill it is about cleaning your hands, washing your hands after you've had such an episode, okay? And likewise, cleaning surfaces in the room that you're in so that the virus doesn't survive on those surfaces as well. As we said last year, this is a disease that is quite infectious, and so as soon as you know you're feeling unwell, it is appropriate and best for you to try and isolate yourself in your bedroom. Now that's not difficult with people who get the flu, because that's the only place they want to be. They quite rapidly, after the start of the illness, within 2 or 3 hours, really just want to be in bed. So we'd advocate that. Don't try and struggle around doing anything else. Go to bed and get looked after. It is a disease that is really very much, for the vast majority of us, where we can look after ourselves by drinking a lot, taking whatever antipyretics we prefer, paracetamol or aspirin, and looking after ourselves, and keeping ourselves away from others until we feel better, and we then are very likely to be able to infect anybody else. So that's very important. There is really no need for the vast majority of the population to come into contact with the health services, be it a GP or the A&E departments, as we said previously. The caveat to that is that we would strongly advise any of the people in the risk groups we've spoken about previously, you all know about, people over 65, the under 65s with the medical conditions and pregnant women. If they get flu, we do advise that they should speak to their GP. The GP knows that they've got it and they can keep an eye on them, and they can get in touch with the GP about what needs to be done. We would also suggest that people in those groups particularly ask about the value of the GP giving them antivirals, because they are at high risk. The other issue is when, if you're somebody like myself, or most of the people in the audience, if you've got the flu but you aren't getting better, again you should get in contact with your GP, and again raise the issue about antivirals. We have got a lot of antivirals available, the GPs know about that, and we believe it would be beneficial for people if those antivirals be used in the circumstances we've talked about. Again, we want to advocate for those people who are in the risk groups that we've mentioned, who haven't already been vaccinated, that they should seek to get vaccinated. It is one of the best preventions. We have that vaccine available. It's a part of the seasonal flu vaccine, and we have other vaccines available that people can easily get vaccinated. We do strongly recommend that people get vaccinated as soon as possible if they haven't already been vaccinated.
That's it. Okay, thank you very much, Kevin. We're now, I think, happy to take any questions.